So for those of us who served in the Obama administration and worked on the Ebola response, it was a really enlightening and jarring and frightening experience, because I think it helped us to understand just how vulnerable the world remained to a disease that could be a lot scarier than Ebola. Ebola was a very scary disease if you caught it, but the chances of catching it, the chances of it spreading on a global level were very small. So I think a lot of us came away from that thinking, my goodness, we are nowhere near where we need to be for something that would be much more transmissible. And so there was a lot of energy in the last few years of the Obama administration to try and put in place what we could to leave the government in a better place. One was to set up a team at the White House that was solely dedicated to health security preparedness and response. The idea there was having a cell of people at the White House who could pull together all of the different parts of the federal government that had a role in this. And, you think of all those parts. It's Homeland Security for the immigration and border stuff. It's the FAA for the airlines and the air travel. It's, of course, CDC and Health and Human Services. It's USAID for the overseas part. It's a very complex operation, and you need that core of expertise at the White House that know where those capabilities sit, and the government knows how to make them work together. Then that new team at the White House pulled together what we called the playbook. That was a document that laid out the different stages of readiness that the federal government would need to go through. Okay, here are the indicators that suggest that you're in the lowest phase of activation. And if you see these indicators, you need to move up to this phase of activation. And here are the key questions you need to ask. Here are the different parts of the government you need to be talking to. One of the things that was identified as an early priority was testing. PPE availability, personal protective equipment, was another priority focus within that document, because we knew that was an area of potential weakness. And so that would have to be an early focus if we saw a novel virus overseas. And it was very explicit in the document that something like COVID should set off alarm bells. The document specifically talked about a novel virus, meaning a virus we hadn't seen before, for which we had no medical countermeasures, and which was showing the ability to efficiently spread from human to human. It was very explicit in the document that that sort of scenario needed to trigger great concern and a lot of active preparation. And I think what we saw instead, partly because they ignored that playbook, was that scenario emerged overseas, and the main response of the Trump administration initially was just to shut down travel from China and to basically assure the American public that the risk was low, but not to trigger the sort of domestic readiness measures that were very explicitly laid out in that document. So initially, when the Trump administration came in, they retained the pandemic preparedness team at the White House. But when John Bolton arrived as the national security advisor, he got rid of that team. The playbook that we left behind clearly was not used, because if they had asked themselves some of those very basic questions at the beginning of this, I think they'd have been in a very different place than they now are. Biologists and virologists and pandemic planners have been pointing out for years that it was basically inevitable that we would see another novel pathogen at some point that would combine very high transmissibility with a significant case fatality rate. To anyone who had worked pandemic preparedness before, it was very clear in late January that we were facing a huge risk in the United States. Watching what was happening in Wuhan, with hospitals being overwhelmed, with the aggressive spread of the virus, there was no reason to look at that and think that we were not equally vulnerable to that here in this country. But we were lucky. We had a head start that China didn't have. We had time to prepare. However, to trigger that preparation, the federal government needed to say very loudly and very forthrightly, but very calmly and professionally, this is a real risk. Hospitals need to be preparing. The public needs to be preparing. You need to be preparing for disruption in your lives. And that wasn't being said. That, in effect, sent a message to hospital executives and to the public and to business leaders that basically this was under control and they didn't need to make any major adjustments. And that was how it was heard. And it was just clearly the wrong message. And part of the reason now we're in such a scramble is because of that poor messaging and that poor risk assessment that we saw throughout the whole month of February from the administration. And I think what is strongly suggested by the reporting of the president's preferences on this is that he didn't want that kind of forward-leaning risk messaging. He was worried that it would spook the stock markets. It's very frustrating for those of us who have worked these issues from inside the government, who know how this works and how it should be done, to then see him try to avoid any responsibility and claim that this was totally unforeseeable, because literally everyone in the public health field has known that this was a real possibility. And anyone who's paid any attention to it, and there are a lot of us, has known how vulnerable we are. So for him to act as though it somehow absolves him that he was unaware this was a possibility, it doesn't absolve him. It just shows how ignorant he was of the risk.
We have done an incredible job. We're going to continue. It's going to disappear. One day, it's like a miracle. It will disappear.
The lack of a coordinated federal response is really damaging. And I've spent a lot of time in the last few weeks talking to local mayors' offices and governors' offices around the country, and all of them use terms like free-for-all, Wild West. We're all competing with each other. You cannot run a 50-state emergency that way. You cannot run a 50-state emergency in which all 50 states are competing for the same pool of supplies, for the same pool of expertise, where they need policy consistency in how they're applying measures, but they're basically left to their own devices to figure out what those measures should look like. The governor of Florida allowed spring break to go forward and allowed the beaches to stay open, allowed the bars to stay open. And all of those kids came down, partied on the Florida beaches for a few weeks, and then went back to places all over the country. And some of them will have brought back coronavirus with them to those communities. That is a decision by one governor in one state that poses risks to almost every state in the country. So when you don't have consistent policy coherence on how we fight this, coming from the federal level, you leave it to each governor and each locality to be making their own decisions, and they're going to make those decisions differently, and it basically becomes a lowest common denominator effort. The basic reality of why we are in the trouble we are in the United States now is that preparedness is a choice, and poor preparedness is a choice. The decision not to prepare in the face of an obvious threat is no excuse when you then find that that threat is overwhelming you later on.